Well, thanks for joining us. I have Dr. Michael Lau with the Prehab Guys. Michael graduated from USC. He's part of the Prehab Guys team. I started following you guys when you had about 10,000 followers on Instagram, and now you have 613,000 followers. Absolutely crazy.
Yeah, I don't even, it's crazy. It's mind blowing. It's never our goal, early on. It's still not our goal, but it's just crazy to see the response. So, it's been an awesome journey.
Well, when you guys first started, you were putting out such amazing content all around educating people about how they could be proactive about reducing the risk of injury, about fixing their bodies, about improving their mobility, their strength, and doing this, with their own, through empowerment, mainly through education. And so I wanted to hear from you, since you've had so much success at it. Obviously, you're doing something right. So what led you guys, and you specifically, to start the Prehab Guys?
I'll say many reasons, but for this talk, the main thing was when I'm in the clinic, I love being with patients. There's nothing that's ever going to replace being with someone, speaking to them, listening to their story, listening to how they got to where they are, and helping someone, take them out of that hole and build them back up. But there's limited time available. I'm very fortunate. I can see about 14 people a day. That's amazing. There's 14 souls that I can touch on a day-to-day basis and help. But that's not enough, in my opinion. There are so many other people out there in the world that can benefit from that conversation that I'm having with patient A. So if we can put the conversation that I'm having on patient A on social media for people to dive into for free, to get in India, to get in China, even to get in San Diego or another city in the United States, that's going to benefit so many people. And we're very lucky in the United States that we have decent healthcare. The healthcare system is not the best, but we have good providers, good schooling, good education. So you have access, even if you may not have the money for it or the insurance to cover it. At least it's there for you to have access. In other parts of the world, you don't even have access to this stuff. So we wanted to provide that education and information to people that either A, don't have access, or B, maybe they don't have the money for it. Maybe like my deductible is like $8,000. I'm not going to go to the doctor unless it's something like I'm dying, I'm literally dying in my deathbed. So there's a lot of people that can benefit from that information that just don't have access. And we want to make that stuff accessible for all. We really believe healthcare shouldn't be behind a wall. It seems very confusing, seems very scary, especially when you Google stuff and there's everything on Google right now. We want to flip the switch and just say, hey, this is what it is. This is what you can do about it. Here's what you need to know. Here's what you don't need to know. And a lot of what you don't need to know is the stuff that you need to shove out the way, because that's the stuff that leads you to going down in this, the spiral of fearing a lot of things, when that's actually contributing more to your pain and dysfunction than the actual quote diagnosis, anatomy, physiology, background, whatever it is yourself. It's the fear. It's the psychological side of it. But trying to help that through education is huge, and empowering people to take those steps themselves, to help themselves instead of having to rely on us, healthcare practitioners, to do it for them.
I love it. That's one of the biggest things that drives me as well, is giving people the resources or the tools, through whether it's through articles or through videos or different education material, to manage their injuries on their own, especially people that have chronic pain, and especially people that have issues that are really persistent, and it may not follow the typical insurance model of physical therapy. Like in the past, when we first began into this profession, it was common to see people 1 or 2 visits or 3 visits per week for an X number of time. And sometimes people need something different than that. So and that was one gap that I had personally seen. Did you see any specific gaps in the rehab industry that you thought that needed to change or needed to improve?
I think there's many gaps. The education one's the big one. In the higher volume model, you don't have enough time to actually listen to someone. You don't have enough time to actually educate them because they're expecting X, Y, Z treatment. And I think I'm a firm believer that 70%, 80% of the people that I see in the clinic probably don't need to see me. They need that one visit to get educated, and then they should be good on their own. So if we can educate those people, that way when I'm in the clinic, those 13 to 14 patients that I see are actually really need to see me. They are immediate post-op, or they had an actual traumatic injury. They had something that actually requires me to be there and spend an hour with them. I want to treat those people in the clinic. I don't want to, not that I don't want to treat other people, but I want to treat the people that really, really need it. Because I think 70% of the other people that we see can use a little bit of education, a little bit of advice, calming their fears. Here's a little bit of movement. I don't care if it's this exercise or this exercise. Let's just get you moving. and then let's see where it goes. And then, okay, if you really need me later, 4 weeks from now, okay, let's talk again. But I think we overutilize so many things in healthcare, and there's all this research now on overutilization of imaging, which then leads to a lot of these things. But there's also overutilization, like you mentioned, of PT, of rehab, 3 times a week for 6 weeks. Jesus, okay, post-op maybe, yeah. Everyone else, we're feeding into the you need me to get better, when it should be the other way around. No one needs me physically. They need the advice that I may give them, but they don't need me. I don't want everyone to, I tell all my patients, I never want anyone to become reliant on me. Like, that should never be how it is. And if I helped you rehab from your knee, you learned the principles of rehab, understanding what type of pain is good, what type of pain is bad, how to adjust loads, how to change training. That way, a year from now, hopefully it won't happen, but it will happen. We all get hurt. We all have pain dysfunction. We're never going to be pain-free. A year from now, when you hurt your shoulder doing something lifting, you know how to take care of it yourself and know how to handle the first 2 weeks to see if it will get better. Because 80 to 90% of the pain and dysfunction we feel, we're like, this really hurts. And a week from now, you forget that you had that little shoulder discomfort or shoulder ache. So if we can educate people to take care of themselves on their own, we free up the healthcare system to actually focus on the people that really, really, really do need our help in person. Because there's so many people I think we can help digitally or just through better education.
The first thing that just came to me when you were saying that was personal responsibility. If I was somebody that was listening to this, so it seems like we all have to do our part. The healthcare provider has to do their part, and then the individual who actually is dealing with the injury, they need to do their part as well. But they often don't know what to do. They often are wondering who can help them. Should they see an acupuncturist? Should they see a chiropractor, physical therapist? Should they go back to their doctor to get injections? Is surgery the best option for them? And they're just not sure who to trust. And so I know many people listening to this might be feeling that. So if I had chronic lower back pain, or I had sciatica, or some musculoskeletal injury, and I've been dealing with this for several months, it's not an acute traumatic injury. I didn't just have surgery. This is something that I've been dealing with for a few years. What would you say to them what would you tell them for trying to manage their injury, get out of pain as best as possible? What would you tell them to do? What would be a good option? Should they see their physical therapist? Should they go to their doctor? Should they expect to see somebody a couple times per week for 12 weeks?
Challenging question. I think it's all going to depend. And I think the first thing that needs to happen is to understand that no one is going to fix you. The only person that's going to quote unquote fix you is yourself. You have to take the steps. Other people may do things like a surgery, but the surgery in and of itself doesn't fix anything. It affixes, attaches some tissue together or something like that, but that doesn't fix the issue. Pain is so much more complex than just one thing. So I would say educate yourself by going online first and reading things from reputable sites like ourselves. Like, go to other sites that are reputable and try to figure out what are the similarities that, say you choose 3 sites or 3 people to listen to. What are the similarities between those 3 people? Are they all saying the same thing, or are they vastly different? And try to pick the things that everyone's saying that's similar and go that route, whatever route it may be. It could be talking to your PT, your acupuncturist, and your chiro. I guarantee they're all going to have 3 different philosophies on how to treat the problem, but I guarantee they're probably going to say something similar, like, oh, right now let's back off a little bit and then let's reassess and reload it again in a week, or something along that. It won't sound like simple, but they will all say something in this, and they may all have a different way to do it. I'm a chiro, I'm going to adjust. Acupuncturist, I'm putting needles in. PT, when we do manual or do exercises. But then what's the total plan of care? Not the actual interventions themselves, but what's the total plan of care look like? And try to find the similarities between what multiple people are saying or what you're reading online, and stay educated. I think that's the biggest thing. I think people think that because we wear a white coat, granted I don't wear a white coat, but when you graduate, you can wear a white coat, or if you work in inpatient, you wear a white coat, or physicians wear a white coat, that it means that that's the know-all. When it comes to our bodies, we're so much more complicated than that. We're not like a car. When a car breaks down, you can do an assessment depending on what type of car it has, whether it be a digital assessment, or you can go in there and look, okay, this bolt's broken. If we fix this bolt, it's going to fix the car. Our bodies are so much more complex than that. So just because someone has an answer to it, someone else may have a different answer to that same problem. And they both may work. That's the thing, what's crazy about it. There's no one that has every answer. If someone had all the answers, we would not even be having this conversation. So it's good to seek advice from multiple people, knowing that it all may be a little bit different, but try to take the similarities of what multiple people say and heed that advice as you maybe choose all 3 people. I don't know. But everyone's going to have a different way, because our bodies are so much more complex than just a car. It's not an A to B to C route. There's thousands of different variations that we all have. So.
Yeah, I like that. It's almost like the truth is a combination of different information from different providers. Now, but everybody you're talking about is going to be somebody who they ideally are studying the research, they're interpreting the studies and research, and they're giving you evidence-based information, not just blogs from so-and-so, but like Michael's going to share his website at the end that you guys can visit, and you can access these articles and video and information. All this is free. And I'll share a link for that at the end of this interview. But this is good information. I'm not just talking about things that are not supported by evidence. And so, and I think that that's what you're saying too, is to be able to get information from reputable people that are using evidence-based practice, using the research, but also just learning from different healthcare providers like acupuncturists and finding out what's right for you, finding out what your truth is. Yeah. Because even though you know the research, there might be a few things that need to change, based on your individual situation.
And everyone's different. That's the thing. What works for you doesn't work for Mary. It doesn't work for Joe. You have to find what works for you. And I get that they could be frustrating, but that's also what makes us so special and so unique, is that we're all different. We're all different people.
So you're really big on education, and which is important. And then it seems to me that there's always, the first step is to educate yourself. It seems like the first step is you need to learn about what's going on. Again, if I was dealing with lower back pain and I had this issue for so many years, I'm listening to this interview, I'm reading some materials online, I'm talking to my doctor about it, I'm doing everything I can to get rid of this pain. Why do you think people have barriers to getting, and I know it's a tough question, but it's like, why do you think there's these barriers in people's head? Like is there some kind of disconnect between where we are right now about our perception of pain right now and then where we need to be?
So you're saying more like a barrier of someone that is in pain, maybe has read stuff and been told what to do, but then's not doing it? Is that?
Yes, and is not doing it. Or doesn't, one thing that I encounter a lot is that people don't feel like they don't believe that they can get better. Or maybe they may not say that they believe they can get better, but subconsciously they do that. Or if I'm seeing somebody in the clinic face to face where I could see their facial expressions, and if I'll say something to them, you can sometimes see that they don't believe that what you're telling them, even though that there's good evidence and research to support it, they may not fully believe that they can improve and that they can get better. They don't trust it.
Yeah.
In some ways, people have lost trust a little bit. It's real tough, I know.
Yeah, that's real tough. I think on a provider side, we have to find ways to get our patients to believe. We have to find ways to get them to buy in by showing them that, okay, we just did this one thing. We kept it very simple. And look, maybe your pain didn't decrease, but now you're able to walk a little further. Flipping the script, because people are just going to be maybe only thinking of, my pain's still at a 4 out of 10. Oh, but wait, you just said you're now walking an extra couple blocks, trying to find other things to get people's mind off of whatever it is that they're focused on. And that's more of a provider thing, trying to flip the switch on the psychology of how we're delivering the information and how we're communicating the information. And then I think on the patient side, it's, understanding that, look, you're in a unique situation. You've had a history of X, Y, and Z, but let's try to find something new. There are so many people that have done the same thing and they continue to do the same thing without getting results. And that same thing many times is a lot of times not doing anything. So it's like, think about it, reflect upon what you've done. Have you been going to that PT for 6 months, 3 times a week, and you feel the same? Maybe it's time to try something different. Or the exact opposite scenario. Have you just been depressed? You've just been reading stuff and scared and not actually taking action to see a PT? Maybe it's time to actually go see a PT. And it's got to be reflecting on what you've done and saying, okay, clearly what I've done isn't working. Let's change it. And there are 1,000 different options you can change. And that's what makes it sometimes confusing. But that's where if you talk to enough people, hopefully you find that there's similarities between what people are saying, and stick with whatever one your gut feels and commit to it for however long you think it should be committed for based on what people are telling you. Okay, 8 weeks. Let's do this for 8 weeks. Okay, I'm going to stick to it for 8 weeks. And have hope that you've changed what you've done. You're taking a different perspective on it. I think the change is huge, but you got to take that first step, and no one's going to do it except yourself. That's the hard part.
Yeah, absolutely. It is tough, and you have to know that you can get better and believe that you can get better.
Mm-hmm.
And then after that, then you initiate the process and actually execute it and take action on that. You guys have, I have to say that you guys have done a really good job with putting out content on your Instagram. The content's easy to digest. It's definitely evidence-based, because you guys you even focus on educating the healthcare provider as well. Not only just the patient or the client, but also the healthcare providers, also other physical therapists. I appreciate what you've done to really help to change the profession. So we're more on the same page. Yeah. So we're more on the same page. We're not just all thinking like every single person's like a guru, but you're really educating on empowering the individual. And then that's one of our main jobs as healthcare providers to do.
Yep. That should 100% be your job, is empowering the person, not getting them to feel like they have to rely on us for everything. Because it's not true. They don't have to. You don't have to.
What are some of the common injuries that you like to see, that you enjoy working with, some of the people that you like to help the most? Do you have any specific diagnoses or a certain area of specialty?
I love lower extremity. I'd say that's about 90% of what I see. So that would be hip, knee, foot, ankle. I love lower extremity. I think in comparison to upper extremity, it blends itself more to, in my opinion, strength and conditioning principles and getting people in the gym moving. And I love the variability that you have in movements when it comes to lower extremity patterns: squat, lunge, lift, like hinge, but then all the different variations of those that you can do throughout the lower extremity. The upper extremity has the same things too, but I like lower extremity. I do like, they're harder, but I do like the people that have been struggling for a year and a half, and then I get them. Because you can make a huge change in those individuals. I have a patient now who had probably got a surgery she shouldn't have gotten. No, not probably. She did get a surgery she shouldn't have gotten. Didn't get any good rehab for a year and a half. And then was going to get a second surgery to clean up the first surgery. And I said, no, it's not happening. We're going to do this. Here's the plan. And I think that's huge for providers, knowing that there's a plan. And kind of what you said, sometimes you don't know what the plan is and it makes you unsure. But if you can be confident with what the plan is, here are the timelines, this is what I want to see at each time, it gives people hope, because they know that there is a plan for them, instead of the ambiguity of not knowing what the plan is. So having a plan is huge, whether that's a plan that you create for yourself or that's a plan that a healthcare provider gave to you. But having a plan is so huge.
Yeah, you really touched on a point about having fear or having anxiety or just uncertainty if you don't have a plan. If there's no structure, if you go to your doctor and they shrug off your pain and give you ibuprofen and they tell you to maybe do a couple of generic stretches and then come back in a while, this has happened many times. In fact, my mom had plantar fasciitis last year, and when she got it, I told her to go to her doctor. She went to her doctor and actually 2 podiatrists, and they both never referred her to a physical therapist. So I was helping her with exercises, and if it wasn't for me, then she wouldn't have had any options to really empower herself. They injected her foot eventually, but they didn't give her any. She still hasn't had any physical therapy, and she's asked for it, and they said it doesn't work. Yeah. You might as well just wait a year. And there is research saying that that plantar fasciitis could go away in a year, but she just felt like she didn't know what to do, and she felt lost. And she's like, what shoes should I wear? And she's like, oh yeah, you can go. The doctor said you can go online, you can look at some things, and it just wasn't satisfactory. It wasn't good enough. So when somebody has a structured plan, it gives them that confidence to know that the person who is helping them not only has their best interest in heart, but there's also a plan. There's a goal. There's an end goal. It can be measured. It's in a specific time frame, and then you know that you're going to have somebody helping you get to that point. So yeah, I love what you said about that.
Yeah, plan is huge for everything in life. Imagine if you're going to the grocery store, you don't know what groceries you're going to get. You're going to the mechanic, you don't know what's broken or how they're going to fix it. You need to think that you need to have a plan, that there is a solution. Even if when it comes to our bodies, it's not a guarantee it's going to work, but there's a plan, and it makes sense in your head that, okay, if I do this, it should help with this. And that plan is very important.
Yeah, as we're sitting here right now, you see that we're in our rooms right now because we're actually in quarantine, because this is we had the COVID-19 outbreak. 2020 is a really rough year.
Yeah.
But here we are, just but there's no plan. And when you see just the lack of certainty, no one really knows quite exactly what's happening with this outbreak. Everybody's scared. There's the level of fear is off the chart.
Yeah.
There's financial uncertainty. We don't know what businesses are going to get closed. My clinic just got shut down today. That's why I'm here. And so here we are just waiting to get word from the CDC and the government and the state government, federal government about what the action plan is. And when there's not a clear cut plan, it just creates a lot of fear and anxiety. And I think that's a lot like what it's like to be going through an injury. If you have pain that's persisted for a year, like what you were saying, you can feel very, scared and uncertain about your future.
100%. Yeah. We need a plan to know the pandemic is real. There's no denying that. But we know that there are things that we can do to slow the spread of it. And they just need to be mandated by a government agency. They say, this is the plan just to do X, Y, and Z. And then we all follow it. We say, okay, that sucks, but yeah, we do it. Because someone of authority that we trust is telling us to do something. And that's what it needs to be when it comes to, our health. But hopefully that person that's telling you to do something is yourself a lot of the times. Hopefully you come up with your own plan. If you created the plan, you're going to be a lot more, the chances of you following a plan that you create are going to be so much better than someone just telling you what to do. If someone just tells you what to do, okay, maybe you respect the person, you do it. It's your dad, it's your sibling or something like that. But if you came up with a plan or you created the plan with your dad or with your sibling, the chances of you sticking to it are going to be more. And that's where the education comes in for everyone out there. If you're educating yourself and you're making the plan yourself or in collaboration with the 4 different people that you talk to, it makes sense in your head. It makes total sense. You say, okay, this is the plan. Let's do it. And then you can go ahead and, do that plan. But you got to be part of that plan making process. If you're not part of it, you're not going to stick with it, or you're not going to believe in it.
Yeah, 100%. And we're all playmakers in this. We all take part in the plan. The healthcare provider does, and so does the individual. Just like this, just with the government. Yeah. If there's a government mandate that tells everybody to quarantine, that might come eventually, but we can still quarantine ourselves right now. We don't have to wait until somebody tells us exactly what to do. So if you've educated yourself and you've gotten information about what you should do for your injury or your pain, then you could already start to take the steps proactively to recover, to manage those injuries better. And you don't have to just wait on somebody to tell you what to do when it's too late, when it's already become a problem, because we know that our healthcare system is very reactionary in terms of musculoskeletal injuries. We don't have a lot of hospital-based systems that are teaching people how to move their bodies correctly, how to train properly when they're at the gym. And unfortunately, there's a lot of training error. There's a lot of mistakes that can get made, and people don't exercise, or they don't dose their exercise programs properly. And that's where having a trainer, having a physical therapist can really help to create that plan and to create that structured program.
Yeah, and that's the plan. Like you said, that's like having a plan from the preventative side. I'm going to plan to eat healthy by buying groceries. I'm going to plan to go to the gym 3 days a week. And maybe I don't know enough. I'm going to plan to hire a trainer to help me with that programming. I'm going to plan to see a PT every 6 months because I know I'm training for lots of marathons just to keep me in shape, even though I don't have pain yet. And your plans can change. There's nothing wrong with plans changing, but you got to have a plan for everything in life. Just like you should have a financial plan. You should know where I have 3 to 6 months of this. I have this in these investments. I have a plan, and it makes you psychologically feel okay with it. If you don't have a plan for your money, you're always going to be concerned about it. Stocks are tanking right now. Whatever. I have a long-term plan. I'm not going to sell a single thing. If I look at my Vanguard account, it's going to go down a shit ton. But I have a plan. I know what it's for. I'm okay with it. I'm going to ride it out. As long as you have a plan, you can be okay with things. And the plan, like I said, it can change. You can change the plan if something you get hurt. Man, now I need to go see my PT a little bit more often. Maybe in order to pay for that, I need to cut back on X, Y, Z. And the plans can shift. You have to be okay with changing plans. But if you have a plan, it'll help with all that fear and anxiety. The plan is important.
Yeah, it's really good. What other kind of tips can you give about managing setbacks? Because just like what we're going through right now, you said the stock market, and there's a lot of people that are going through financial difficulty right now. If people are in physical pain, then they often deal with setbacks. They take 2 steps forward, 1 step back. They might reach a goal, and then they feel pain the next day, and then they feel like they're back to square one. They're really disappointed. So what can people do to just keep making forward progress? How can you manage these setbacks?
I think the biggest thing is the psychology of it. What you just said, I feel like I'm making 2 steps towards, one step back. Well, your average is still 1 step forward. It's that moving average that needs to be going up, and know that it's never clean. It's the stock market. It's like tons of up and downs. Right now we're at a big down, but trust me, that average means 7%, and it's going to go up. It's going to take some time until we reach those averages, but know that the average is going up. As long as your plan's trajectory is positive, be okay with setbacks, because if you didn't have setbacks, it's almost unrealistic to not have setbacks. You're going to have setbacks. If you're actually pushing the envelope to get better, your body's going to respond and have setbacks, because you're giving your body new things that it's not accustomed to yet. You're changing over, you're taking over your psychology, you're taking over your movement. Wow, I'm going to go on this walk that I haven't done before a little bit longer. I'd expect you to be sore. Be okay with the soreness, be okay with the discomfort, as long as the average is moving up. That's the thing I always tell people. If your average is going up, that's okay. But it's when the average is going down, then okay, then we had to do something about it. But the average should be going up with tons of setbacks along the way. It's just kind of part of the journey.
So 1 or 2 years down the road, you go through some setbacks, but if you look at where you're at 2 years later compared to where you are today, then you're a lot better. Almost the worst thing that you can do is to just not take action, and then you don't do anything.
Exactly. And even if where you are today, you're still not running the marathon pace at 4 hours and 30 minutes. Just think, well, 2 years ago, I wasn't even able to run a marathon. So I'm proud that I'm doing it in 5 hours, not 4 hours and 30, like self-reflect and be like, wow, I'm thankful that I'm even able to run a marathon. I've never run a marathon in my life, probably never will. So you should be thankful you're able to do it. Like, as long as you look back, like you said, look like 2 years, where was I then? Damn, I've come a long way from then. Still not at my ultimate plan goal, but I have a plan to get there and to continue striving to get there. That's the most important thing. It's like what they say. It's not reaching the end point that's great. It's the journey that gets there. So be okay with that plan and be okay with that journey that's getting there. That's the most important.
Yeah, 100%. I love that. It's all about the journey, because just the end goal is great. I mean, the end goal is different for every single person, and we're always comparing ourselves to other people. Oh, this person can lift this much. This person can squat this much. This person ran the marathon faster than me, or they could even run a marathon, and I can't. I could just run a 5K. It's different for every single person. So it's just about finding out what makes you happy, and then just being grateful for what you can do, instead of focusing on all those other things that you're maybe not able to do.
And guess what? If you're actually a driven person, as most people are, the moment you hit that goal, you set another goal that's higher. There's a reason they're called PRs. You hit a PR and then you go for another one. You hit a 4 mile, 6 mile pace, you're going to go for a 550 pace. Like, you're always going to be striving for more. So it's the journey of getting there and having that plan and journey that, okay, now a new goal. Because you're always going to want more. That's just why they say money doesn't buy happiness. When you have more money, you realize you want more. It's the same thing with anything in life. You always will be striving for more. That's something I know me personally, I'm trying to better at, because I'm so future driven and I set goals for myself that I want to hit. And I'm like, well, that's stupid that I'm always thinking in the future, because I know that I'm going to hit those goals, and then I'm going to not feel content because I want other goals, when I just need to be content with where I am now, what I have now, what's around me now, and be present. So we're always going to be striving for more. Just, again, self-reflect on where you're at now, where you've come, and be content and be happy with that.
Yeah, I love what you said about just like creating smaller goals. It doesn't have to be this far off end goal. There could be smaller goals, get to the bigger goal.
Yeah.
And every time you reach one of those goals, it just feeds your reward system. You get excited, you know that you accomplished it, you made that commitment to yourself and fulfilled that commitment.
Yeah, and it feels good hitting those small goals. And it feels amazing.
It feels great.
Yeah, it feels really, really good.
Well, it's good. These are really good tips as far as just knowing that we need to educate ourselves, knowing that we need to take action to learn more about how we can manage our injury. We can take information from other healthcare providers. We can put it all together and think about how that applies to our situation, and we can find truth that applies to us. And then we can focus on having a structured plan and making sure that we have specific goals within that plan that are attainable, that we can reach. And then along the way, just making sure that we're managing our setbacks and not getting too disappointed, and realizing that in the end, even though we're going through really low moments, if we just keep our head forward and keep at it, we're still at the end of the day going to be making progress. And even though if it takes a lot longer.
Yeah. Yep, always making progress. It may take longer, up and downs, bumpy journey. Everyone's journey is different, but we're making progress and we're moving forward. Time's not stopping. We're moving forward with it. We're going.
Yeah, got to keep going.
Yeah.
Well, if somebody wants to get in touch with you, or if they want to learn more information about the Prehab Guys and consume some of your great content, where do they go to do that?
We have so much amazing content. Our website is kind of the hub of everything. It's theprehabguys.com or just prehabguys.com. On the website, we have this button. It's an explore button or search. You use that search bar, you will find literally any answer you are looking for. And then it's all free. We have tons of stuff on social media. Our handle on Twitter, Spotify, YouTube, LinkedIn, even TikTok for the younger generation. It's all at the Prehab Guys. And just we post once daily, even more on some other channels. Just tons and tons of content that you can follow along. You do a lot of this stuff at home, especially in the environment we're in now. But you can follow along, get educated, figure out ways to take control of your health and be proactive instead of reactive.
Awesome. I love it. And guys, check out their content. It's really great. I read their information all the time. They got good videos, especially their articles too. Go to their website. You can find out different topics. And even if you're a physical therapist, check out their information. And you'll definitely be learning and feel more empowered to control your health.
100%. Thank you, Mark. Appreciate you having me on.
Appreciate the time, Michael. Have a good day and stay safe out there.
Yeah, thank you.
All right. See ya.